Good day, everyone. I am Michelle Jane Sevilla, a student nurse from BSN 111B. And for today, I will be performing an assessment of the abdomen. Assessment of the abdomen can provide diagnostic use of the gastrointestinal and genitourinary pathologies, and it could also give insight regarding abnormalities among other organ systems. So the first thing that we need to do is to review the client's medical records, and this will allow me to get basic information about the client. After that, I will determine the scope assessment needed and prepare the necessary equipment prior to meeting the client. So the first thing that I need is a measuring tape, a stethoscope for auscultating abdominal sound, a pen to mark, and our ruler. Now that I'm done preparing these materials, I will be performing hand hygiene. This is done to deter the spread of microorganisms, and wear gloves if deemed necessary. This time, I will greet the client politely, then I will introduce myself and verify the client's identity. So good morning, ma'am. I am Michelle Jane Sevilla, your student nurse for today. And can you kindly state your name and your birthday, please?
My name is Michelle Jane Sevilla, and I was born on September 20, 2004.
So, Mr. Ligero, how would you like me to call you?
Can you call me Sheila?
So, Miss Sheila, for today, I will be with you for your assessment of the abdomen. That means I'll be needing you to remove your clothes so that I will be able to inspect, auscultate, percuss, and palpate at the same time in order. I also want you to know that you need to assume several positions for this examination. Will that be fine with you? So if you have any questions, feel free to ask me. Do you have any clarifications? Then I will ensure the client's comfort, privacy, and confidentiality to avoid distractions, and then of course establish rapport with the client. So, Michelle, you don't have to worry because all of this information that I'll be gathering today will be kept confidential. So, are you comfortable now with your position? Okay, so I'll be providing you with your privacy by closing the door before I proceed with the assessment. Alright, so one last thing, I need you to void or urinate first to eliminate bladder distension that might interfere with the abdomen assessment. So I'll be waiting for you here after you're done. Okay, Miss, thank you for your cooperation. I will now position the client in a supine position with arms folded over her chest or by just lying at her sides, and then place a pillow underneath the patient's knees. This position ensures abdominal muscle relaxation to avoid putting additional pressure on the patient's abdomen. I will also drape the body of the client with the blanket, but I will only leave the abdomen, which is the only part that I'll be assessing. So do you feel any pain with your abdomen? Okay, so for the first part of the assessment, I will be only observing the patient's abdomen. So is it okay if I lift your shirt? So I can see that there are no visible vascularity that might indicate circulatory issues. You don't have any stretch marks either. Your abdomen is free of scars, lesions, and rashes as well. If there were, I will be noting for it. and its location on your abdominal quadrants. So now I'm going to inspect for your umbilicus for its color, contour, and location. So the umbilicus skin tone are similar to the surrounding skin tones or even pinkish. It should be recessed or inverted or protruding no more than 0.5 centimeters, and it should be round and conical. It is also not deviated from the center. Now to observe for abdominal contour while the patient lies supine on the bed, sit beside the client and look across the abdomen at a level slightly higher than the patient's abdomen. So can you breathe in and out from your mouth? And hold it. So this makes an enlarged liver or spleen more obvious. So the abdomen is normally flat, rounded, or scaphoid. So now inspect the area in between the lower lids and pubic bone and note for any abdominal enlargement. Now measure the patient's abdominal girth by placing a measuring tape around the patient's abdomen at the level of the umbilicus. So the abdominal girth should be measured at the same time of the day, ideally in the morning just after voiding. And mark the abdomen with a ballpoint pen to aid in the measuring site. You lift your This mark, mom, you just don't have to wash this until the assessment is complete. So now stand at the foot of the bed and observe for abdominal symmetry. So can you raise your head for me, ma'am, so that I can assess for herniation or diastasis? Okay. It should have a symmetrical contour, so while doing the inspection, also observe for abdominal respiratory movements, aortic pulsations, and peristaltic waves. This time, ma'am, I'm going to proceed to listen over your abdomen. I just want to ask, when did you last eat?
Last
So, recent intake may have increased the peristaltic activity. Now, warm the hands and the diaphragm of the stethoscope to avoid startling the patient of the coldness of the stethoscope. Apply light pressure or simply rest the stethoscope if the abdomen is tender or painful. Now auscultate all 4 abdominal quadrants for at least 1 minute each, starting from the right lower quadrant and then proceeding in a clockwise pattern, noting for the intensity, pitch, and frequency of the bowel sounds. To auscultate the vascular sound, use the bell of the stethoscope to listen for brewing. It is a low-pitch, murmur-like sound pronounced over the abdominal aorta, renal, iliac, and femoral arteries. Now auscultate for the venous hum. Use the bell of the stethoscope to listen for venous hum in the epigastric and umbilical areas. This time, place the diaphragm of the stethoscope over the right and left lower rib cage or over the liver and spleen and listen for friction run. Proceeding now to the percussion of the patient's abdomen. With the percussion hand technique, lightly and systematically percuss all quadrants. Percussion may proceed clockwise or up and down over the abdomen, because several areas in each of the four quadrants determine the presence of tympany or dullness. Tympany is a high-pitched musical sound that indicates a hollow space filled by air, and dullness suggests fluid or feces. Now, percuss the span or height of the liver by determining its lower and upper border. Determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, then upwards. Note the change from tympany to dullness and mark the area. This time, assess the descent of the liver. Locate the liver border of dullness. Ask the client to take a deep breath. Observe for the descent of the lower border of liver dullness below the costal margin and deep inspiration. Ma'am, please take a deep breath for me. Now ask the client to hold his or her breath and perform percussion, and ask the client to exhale afterward. Ma'am, please hold your breath for a moment. Okay. So this time, percuss the upper border of the liver. Locate the upper right chest at the mid-clavicular line and percuss downward. Mark the point where the change from the upper right chest or lung resonance until liver dullness is noted. This is the upper border of liver dullness. Then measure the liver span, which is the distance between the two marks. Repeat the percussion of liver at the mid-sternal line. Now percuss the spleen. Begin percussion on the posterior to the left mid-axillary line and percuss downward. Note the change from lung resonance to splenic dullness Perform a second method of percussion to determine enlargement by asking the client to take a deep breath and start percussing on the last left interspace at the anterior axillary line. For the blunt percussion on the liver, ask the client to sit with her back to you. Place the left hand first against the lower right anterior rib cage and use the ulnar side of the right fist and strike the left hand. After that, note any tenderness upon percussion. For the blunt percussion on the liver, place the left hand first against the lower right anterior rib cage and use the ulnar side of the right fist and strike the left hand. After that, note for any tenderness upon percussion. Now for blunt percussion on kidneys, ask the client to sit with her back to you. Place the left hand on the costovertebral angles and begin percussing on the posterior to the left mid-axillary line and percuss downward. After that, note the change from lung resonance to splenic dullness. Ma'am, can you sit with your back facing me?
Okay.
Now you can lie back. Perform light palpation to assess for tenderness and presence of mass with the client lying relaxed in a supine position. Begin with a light systematic palpation of all 4 quadrants or 9 regions using the finger pads, initially avoiding any areas that the patient had identified as painful, and observe for reports of pain, tenderness, guarding behavior, and masses. Now perform the palpation, which is done to feel for the internal organs and masses. Compress the abdomen to a maximum of 5 to 6 centimeters using the palmar surface of hand. Avoid painful areas and palpating for muscle resistance or masses. Perform moderate palpation at the umbilical ring, noting any presence of masses, swelling, nodule, granulation to assess for tenderness and presence of mass. Palpation of the abdominal aorta. Use both hands to deeply palpate the epigastrium slightly to the left midline. Also assess for pulsation. Now palpate for the liver to assess for liver contour, surface, presence of nodules, tenderness, and irregularity. Place the left hand under the client's back at the level of the 11th and 12th ribs, while the right hand is laid parallel to the right costal margin, with fingertips pointing towards the client's head. Instruct the client to take a deep breath, then compress fingertips upward and inward to the lower border of the liver and assess for contour surface, presence of nodules, tenderness, and irregularity. Kindly take a deep breath, ma'am. Now perform the hooking technique. Stand at the client's right side facing her feet. Then press in and upward the costal margin with fingertips and ask the patient to take a deep breath gently and firmly. Pull inward and upward with your fingers. Palpate for the liver edge as it descends to meet the fingers, noting contour, surface, presence of nodules, tenderness, and irregularity. Ma'am, can you take a deep breath? Palpate the spleen and assess for splenomegaly. Stand at the patient's right side and reach over the patient's abdomen with the left hand under the posterior lower ribs and pull up gently. Place the right hand below the left costal margin. Press in toward the spleen. Ask the client to take a deep breath, then press inward and upward using the right hand as the left hand provides support. Can you take a breath? Now begin palpation at the costal margin and try to feel the tip of the spleen as it comes down to meet the fingertips. Note for tenderness and assess the splenic contour. Can you please take a deep breath, ma'am? Repeat the procedure with the client lying on the right side with legs somewhat flexed off the hips and knees as needed. Ma'am, I need you to turn on your right side. Okay, take a deep breath. Okay, you can now breathe normal and go back to your position. This time, palpate the kidneys to assess for kidney enlargement. Stand at the right side of the patient. Place the left hand under the patient's right posterior flank and the right hand on the right costal margin at the mid-clavicular line. Instruct the client to take a deep breath and compress the fingers during peak inspiration, then ask them to exhale and hold her breath briefly and gradually. Release the pressure of the right hand to feel the right kidneys slipping beneath the fingers. Exhale, ma'am, and hold your breath for a moment. Now palpate the left kidney with the procedure reversed. State the urinary bladder. Begin palpation at the symphysis pubis and move upward and outward to estimate the bladder borders. Exhale and hold your breath. Okay, you can now breathe normally. As for appendicitis or peritoneal irritation, rebound tenderness or Bloomer's sign, palpate deeply at 90 degrees into the abdomen halfway between the umbilicus and the anterior iliac crest, then suddenly release the pressure. Listen and watch the client's expression of pain as the client describe which hurt more, the pressing in or the releasing, and where on the abdomen the pain occurred. Okay, ma'am, do you feel any pain while I was pressing your abdomen? Do you feel any pain when I released your abdomen? Pain induced or worsened by withdrawal is rebound tenderness, suggesting peritoneal inflammation. Now, for referred rebound tenderness or Bloomer's sign, palpate deeply in the left lower quadrant and quickly release the pressure. Okay, ma'am, do you feel any pain when I press your abdomen? And do you feel any pain when I release your abdomen? Pain in the right lower quadrant during pressure in the left lower quadrant is positive of promising signs suggesting acute appendicitis. Now, test for SOA sign. Reposition the patient in a right side lying position and then hyperextend the right leg. Ma'am, can you your sign? Okay, tell me if you feel any pain. You feel any pain? Now you can move on. So pain in the right lower quadrant or the psoas sign is associated with the irritation of the iliopsoas muscle due to appendicitis. Now test for obturator sign. Now support the client's knee and ankle and flex the hip and leg and rotate the leg internally and externally. Tell me if you feel any pain. You feel any pain? Okay. Pain in the right lower quadrant indicates irritation of the obturator muscle due to appendicitis or perforated appendix. Hypersensitivity test. Using a sharp object, stroke the patient's abdomen. Do this several times and note any complaints of the pain. Okay, ma'am, do you feel any pain in your abdomen? Pain or an exaggerated sensation felt on the right lower quadrant is a positive skin hypersensitivity test and may indicate appendicitis. Test for Murphy sign or test for cholecystitis. Press your fingertips under the liver border at the right costal margin and ask the client to inhale deeply and note for any increase in pain felt. Can you please inhale deeply, ma'am, and tell me if you feel any pain? Do you feel any pain? Here. How about here? Okay. You can now breathe normal. So a positive Murphy sign is when pain occurs when the examiner's hand comes in contact with the gallbladder. Okay, ma'am. So now that we are done with the assessment of your abdomen, here is the summary of what we have just done. So upon inspection, your skin is uniform in color, no rashes, no lesions, and no scars. Your umbilicus or your navel is midline and inverted, which is pretty normal. Your abdomen is symmetrical, and upon auscultation of your bowel sounds, while I was listening to your abdomen, the sounds are pretty normal and I hear no brewy or venous hum. So while I was measuring your liver size, your liver span at the clavicular line is 7 centimeters. And while I was measuring for your liver span at the mid-sternal line, it is measured at 5 centimeters, which falls within the normal range. So upon percussion and palpation, there were no tenderness, no masses, no bulges, and no swelling. Overall, your abdomen is doing pretty good. So do you have any questions or clarifications? Okay, your overall, your abdomen is doing really good. But before I leave, I just like you to give some advice on how to keep your internal abdominal organs healthy. I advise you to increase your fluid intake, such as water, to flush out unwanted residues in your liver, your bladder, and your intestines. So if you have any urge to pee, then do not hold back or do not delay, because holding back your pee might cause the bacteria to multiply and can cause serious diseases such as urinary tract infection. So that is all. Again, do you have any questions or clarification perhaps? So that is all. Thank you for your cooperation in this assessment today, ma'am. So after performing the assessment, perform hand hygiene. So that's the end of the assessment of the abdomen. Thank you.